Sometimes it really feels like it is the end of the world.
In Malaysia, it is estimated that currently there are 250,000 people that have bipolar disorder. Bipolar disorder is often misunderstood, and the stigma surrounding it is almost taboo-like. So today we invited 3 people that have been involved with bipolar in one way or another to share their perspectives.
Dr. Ant. I'm the psychiatrist, and currently I'm teaching in Monash University, Malaysia, and also working as a consultant in KBJ Putri. I graduated from the University Malaya, and I got my psychiatry specialties as a consultant in University Malaya. And subsequently, I obtained a PhD in the addiction psychiatry, also in the University Malaya. Yeah, I've been in this line more than 25 years. Bipolar disorder basically is a brain disorder. So affects several areas of the brain, and particular those that involve in the emotions, regulations, and decisions making. First one will be the prefrontal cortex, which is just in front of our brain, which is our front brain. It is very crucial for those high order cognitive functions like planning, like decisions making, impulse controls, and social behavior. So, people with bipolar disorder, these regions often show reduced activities. So that's why, usually during these manic episodes, that's why, they become impulsive. They make poor decisions and they involve in the risky behaviors. So amygdala is a very small area. It's only like an almond size of the almonds. So it's at our central area, and this is a crucial central role in processing the emotions, especially fear, anxiety, and emotional reactions. So in bipolar disorder, this area will become hyperactive and may lead to excessive emotional reactivities and intense feelings, which can manifest like irritability, agitations, and euphorias. Um, when then in other sites, during the depressive episodes, over activities in the amygdalas can actually contribute to feelings of sadness, hopelessness, and anxiety. Bipolar disorder, no matter what type is it, it's we divided into 3 phases. So there are 3 phases. One is acute phase, acute stabilization phase, and the last one is maintenance phase. Acute phase is when symptoms are at their most intense, whether they are manic or they are depressed. So we basically need immediate interventions to prevent harms and stabilize the individual. So that is the acute phase. Acute stabilization phase. So this phase actually begins once the immediate risk of harms has been reduced. So we have actually cut down their symptoms by 50%, and the patient starting to show improvements, but it's not yet a fully stable mood yet. So this phase aims to stabilize the mood and prevent the recurrence of the severe symptoms after the acute episode has been controlled. Be a maintenance phase. That will be a last phase. So this one is to help the individuals to lead a stable and productive life. So our aim is mainly to prevent the recurrence of the mood episode. Basically, for the key medications, for the each phase, acute phase usually is mood stabilizers, antipsychotics, benzodiazepine, antidepressants. If let's say they are in a depressive phase, the acute stabilization phase is continuations of the mood stabilizers and antipsychotics, tapering off the benzodiazepines, and you can actually start a psychotherapy. The maintenance phase is, of course, long-term use of the mood stabilizers, possibly, well, it can be antipsychotics, or right, along with the ongoing psychotherapies and lifestyles management. So, in conclusion, I think treatments for bipolar disorder, it requires a phase-specific approach.
We are greatly thankful for Ms. Ann's valuable insight into this often complex mental disorder. As we continue our exploration of bipolar disorder, let's shift our focus from a scientific level to a more holistic approach. Oftentimes, medicine can only better one's physical symptoms. But what about the mental struggles within?
My name is Evie. I'm a clinical psychologist, graduated from Help University. So I've been practicing for a few years right now. So I'm currently practicing in an NGO. I'm also practicing in several private sites. So I mainly work with clients who struggle with mental health and emotional challenges. Like, for example, the cases that I'm taking, including depressions, bipolar disorder, anxiety. I also provide assessment and diagnosis, like for ADHD, autism, and other neurodevelopmental disorders. I'm doing a lot of advocacy work. So I provide a lot of trainings, like mental health first aid, a lot of awareness workshops also. So I go into the universities, I go into the workplace, like companies. I always say first line of treatments for bipolar is always medication. But it's also very important that not only medications but also therapy as well. So based on my experience, my role as a clinical psychologist, cognitive behavioral therapy, or in short form CBT, is usually the most effective way. So which involve helping the clients to identifying and challenge the negative thoughts patterns that can affect their emotional well-being. Bipolar develop like high, what we call as manic episode, and of course when they crash, is they really crash like depressive episode for a period of time. So how CBT is being very helpful is again CBT is cognitive and behavioral. So in terms of cognitive wise, for example, when people are going through a depressive episodes, there might be a lot of having a lot of negative thoughts, self-sabotaging statements and so on. So cognitive parts, we will teach clients to identify negative thoughts patterns and to challenge them. But as for behavioral parts, because of they have lots of highs and downs, right? So a lot of times their routine will be interrupted. All their daily life will be affected. So the behavioral part will involve like setting some, let's say, homework or some structured tasks for them to be able to practice in their daily life so that they were able to maintain their optimal function. Medications help to tackle the biological part. So you have to reduce the symptoms, manage the mood swing in so that less intensity and also less frequency. But for psychotherapy, it's very important to target things beyond the medication. For example, improving their lifestyle, their negative thoughts, and improve their overall life functioning.
It is evident that therapy also plays a major role in one's recovery from relapses and in managing this chronic condition. However, to truly understand the day-to-day struggles of bipolar, it is important to go to the source.
It was a normal childhood, but I had to endure a lot of bullying and a lot of unhappy things when I was growing up. I did go through some assault, like sexual assault when I was younger. Hi, my name is Alice, and I have been diagnosed with bipolar disorder for around, I'd say 2-3 years now. I was seeing a clinical psychologist at that point, and she did mention she suspected I had a psychothermia, which is like a milder version of bipolar disorder. I started getting psychotic episodes where I would hear people talk to me that weren't there. I would hear people call my name and see shadows and hear things that weren't there. So I got sent to a psychiatrist, and she diagnosed me with bipolar disorder, and that's how I got my diagnosis. I get really high. The first few days would feel pretty happy, pretty nice, and then I have a lot of creative energy and I do a lot of things. I don't need as much sleep. Most I haven't slept was almost 7 days. When it got to the end of my mania, I would just be really, really angry at no reason at all. I'd start fights with people. It was very embarrassing. When I get depressed, I would just rot in my bed. I didn't go out of the house for maybe a few days at a time. I wouldn't leave my room. I wouldn't see anyone. I didn't want to talk to anyone. I just felt really alone. But at the same time, I felt too exhausted to try to socialize with anyone. It's kind of like a little bit of a setback because I wanted to go study overseas when I first graduated, but because of the medicine and the cost of medicine overseas, I decided to give that up because I was concerned that if I was alone overseas by myself, that I would have no one to turn on to, no one would be able to look after me and see how I was doing, because sometimes I really can't tell if I'm in an episode or not. And the medicine overseas, I don't know if it's easy to get medicine or the cost of it, so I basically turned that down and just decided to stay in Malaysia instead. It's a kind of like a regret. Take Seroquel every night and it helps me sleep. It regulates my sleep and it keeps my symptoms at bay. Although I still get episodes, it's not as bad as the ones that I used to get. And yeah, I try to go to therapy when something's wrong. I try to use all the therapy techniques that I've learned throughout the years, and it really helps to manage the symptoms as much as I can. I remember this instance when I was learning how to drive. I mentioned that I couldn't go to one of the dates that they booked for me because I had an appointment with a doctor, and then he asked me what doctor I was viewing, and I kind of told him like, oh, I'm seeing a psychiatrist and all that. And he kind of basically told me to go to church and pray it away, or that talking to other people and trying to convince me to get off my medicine.
A lot of people also ask me, how can I help my loved one to actually deal with the bipolar disorder? I always tell them that bring them and together with them, work with them, to seek for this professional advice. You just need to accompany them to go inside the consultation room together with them, and also to learn what is bipolar. So what can I help, right? For this person.
Validate them. So people struggling with bipolar disorder, they are struggling. So they might not be able to manage their mood swing very well. So if let's say you happen to notice that someone, your loved one, is going through the mood swing, just point out to them, say, hey, I think that you might be going through some high period of your life. So because a lot of times people struggling with mental health issue like bipolar, they might not know, or they might not catch it on the spot. Also, to treat them with dignity and respect. So don't treat them at someone said, this person is always mood swing up and down. Just be friendly, supportive.
It's very tiring to fight alone. Understand them and don't judge. Understand the illness, understand the person, understand what was happening, and try to help them, as in comforting them and telling them everything's gonna be fine, that you're gonna be there for them. Because sometimes people lump us together where they think that just because we're bipolar, that's all we are. And the bipolar is just a part of us. We are people that have bipolar. We're not just bipolar.
As we concluded our exploration, we asked our interviewees one final question.
Seeking the right support. So I would actually say to seek for professionals' help. They can actually, there's a support groups join those activities, and then to understand their condition more, and also to exchange the experiences. I think that will make a person feel less isolated.
Bipolar disorder doesn't define who you are, right? So surround yourself with people who are supportive. Of course, educate yourself with the conditions, and always remember that seeking help or seeking treatment is a very responsible choice that to help you to improve your life functioning. So always remember that like having bipolar disorder is not something shame. It just means that we need help and the help is available.
There's a lot of resources out there, and it's not the end of the world. You're not alone. There's a lot of people like us. You have to do this by yourself. There's a lot of people that will understand you and love you, and there's always help out there. Please, please, please don't give up, because there will be better days, and I promise that as for someone that has gone through the darkest times because of it, there will always be light at the end of the tunnel. The only reason why you're covered in darkness is because you're a beam of light.